or caught the virus and then developed an immune response and have got antibodies in their blood. We're beginning to see some studies from other countries that are doing that. It's not straightforward, firstly because the tests are still being worked out and we don't have the perfect test for antibodies yet. Secondly, we don't know how many people produce antibodies when they've had the virus and when they produce it and how long those antibodies last for. But that's the important information that will give us an actual figure, which is much more closer to the actual number of infections. That work, as Sir Patrick has said, is ongoing in the UK at the moment, so we can have that information for the UK rather than relying on other countries. It will be a very important piece of information in terms of plotting our way forward and planning for the next few months. But I think, as I've said, I think rather than going back to what was said a few weeks ago when we were in the early stages, what's important is to get an actual handle on the number using the techniques that I've just described.
Great, and you also asked about ventilators. As of today, there are 10,606 ventilators within the NHS. As I understand it, 190 of those have come from the new UK suppliers who rose to the challenge that the Prime Minister and the Health Secretary set to British industry to use all of their ingenuity and engineering skills to turn their attention to this task. I think the most important point, and Steve may wish to add to this, the most important point to say is that there is sufficient capacity today in the NHS. There are sufficient ventilators, and although you can never exactly predict the future trajectory of the virus, we're increasingly confident that there will be sufficient ventilator capacity in the NHS in the weeks and months ahead, which is obviously hugely reassuring to all of us, because just a few weeks ago that was one of our great concerns. Would we have that capacity? It seems like we have, and of course there are more ventilators coming on board from those UK suppliers and internationally as well in the days ahead.
Yes, so I don't think we are not constrained by ventilators at present, and we've in the NHS constantly striven to make sure that we have the capacity to manage the surge in patients that we've seen, and I'm really proud that our staff have done that. I think on the broader point, as you would expect with a new disease, a new virus, our clinicians are learning about the management of patients all the time. We have some of the best critical care doctors and clinicians in the world in this country, some of the best chest, respiratory, lung physicians in the world, and I'm absolutely confident they will be giving all patients the best possible care. But we are learning which particular sort of ventilation, which particular mode of ventilation works the best. So one example that you will have seen is it's not always necessary to put people onto ventilation where they need to be intubated, have a tube and go on a mechanical ventilator, although that is absolutely necessary in many cases. Sometimes you can manage the problem with the oxygen in the lungs through a tight-fitting mask, so-called CPAP, continuous pressure airways ventilation. And we are learning all the time who might be more suitable for that and who might be suitable for other forms of treatment. That's an international effort. So I've doctor for many years. In my specialty, kidney disease, I spent a lot of time talking to my colleagues around the world, learning from them, and they would learn from us. That's how medicine works. You learn through international collaboration. So I'm absolutely confident that our critical care clinicians, in fact, I know they are not only talking amongst themselves and discussing what they're learning, but are also talking with their colleagues around the world. And that will continue to evolve. We will continue to learn more about the optimum treatment and management for patients with COVID-19.
Does that answer your question, Dave?
Yes, thank you. Very detailed. Thank you.
Brilliant. Thank you very much. And the next question comes from David Maddox of The Express. David.
Good afternoon. Secretary of State, first of all, is there an update on the Prime Minister's health? Has he been able to speak to any ministers in the last week since he was released from hospital? Looking also at the graphs that you presented today, a question to both of you really, there's obviously a significant reduction, particularly in London, on hospital admissions. We've had a series of big announcements on vaccines, PPE and testing. Are we finally on the front foot in the battle against this virus, or are we still running to catch up? And finally, sorry, if I may, one quick other one. When we do come to loosening the lockdown, obviously people are going to be feeling quite nervous, and there's going to be a great deal of anxiety still about going out. Is there any thought on how people can be given confidence that it will be safe?
Thank you. Well, as regards the Prime Minister, you know, he's resting and recuperating at Chequers. He's taking his doctor's advice. He has had some contact with ministers, but mostly with his private office here at Downing Street, and that's absolutely right. I mean, we all wish him well and hope that he takes the time to get better as quickly as he possibly can. In the interim, the First Secretary, Dominic Raab, the Foreign Secretary, is leading. He's chairing the cabinet meetings and the other important COVID response meetings that are happening every day. And with us as a cabinet, taking important decisions. For example, as you say, the decision this week to extend the lockdown measures for a further 3 weeks. And so that's absolutely right. As regards to where we are, I mean, I'll let Steve talk to the numbers as he sees them, but it is absolutely correct that the hard work, the forbearance, the fortitude of the British public is paying off. The rates of transmission in the community are falling, and there's a number of positive indicators which give us cause for hope and to believe that there is light at the end of the tunnel. But nonetheless, the number of deaths that I've announced today remains extremely sobering, and more of us, I think, across the country know somebody who has been unwell. More of our lives have been touched by this virus as every day goes by, and I think that just reinforces to us all the need to consider this moment as the one to keep going. Don't lose what's been hard won over the last few weeks. Keep adhering to the measures, keep respecting the advice from the clinicians. And if we do that together as a society, then in the weeks to come, there may be opportunities to begin very cautiously to ease the lockdown measures. But that day is not today, as the First Secretary said just a few days ago. Steve.
Yeah, so it is encouraging, as you pointed out, that we are beginning to see a reduction in the number of people who are hospitalised with COVID-19, and London, as I said, and as you pointed out, is where we are beginning to see it earliest. But that's only happening, as I also said, because all of us are complying with the social distancing instructions. And if we have begun to get on the front foot in complying with those instructions, I think what's absolutely critical, as the Secretary of State has said, is to ensure that we don't go onto the back foot and we don't lose all the benefit that has been gained, because this is not something that is going to be dealt with in a matter of weeks. This is something that will require getting onto the front foot and remaining on the front foot for a good period of time. And so what's absolutely critical, though we are encouraged and though there is evidence that following the instructions, following the social distancing guidance is beginning to result in benefit, we absolutely need to keep that up. This is not the time to rest on our laurels, to think that we've got on the front foot and therefore we have to stop complying with instructions. We need to continue to keep getting onto the front foot. I don't think we're there yet.
Thank you. And as regards your question about whether people should be concerned about a future easing of the measures whenever that is the right time to be deployed, well, a great deal of work is going on within government to consider how one might do that. Steve and his colleagues within the NHS are experts at SAGE, and others are working with us across government to prepare to see what's happening in other countries and what are the best steps that we could take in the future. But as Steve says, that moment isn't today, and the present situation remains finely balanced, and we don't want to waste the hard work and sacrifice that's happened in recent weeks. So the message very much to everybody watching at home today is continue to pay heed to the advice, continue to follow our message, which is to stay at home, to protect the NHS and to save lives. If we do that, then we can look forward to loosening and a gradual return to normality in the weeks and months ahead. The last question I have today is from Vic Mutuna, who is from The Voice. Vic.
Secretary of State, many thanks. I'd like to ask two questions, if I may. The first I'd like to address to Mr. Powis, and then the second to yourself. Mr. Powis, in your answer earlier, confirming the fact that there will be a formal inquiry into the fact that COVID-19 seems to be having such a disproportionate effect from people from Black and minority ethnic communities, you mentioned that there would be a number of experts who will be involved in that inquiry. Could you tell us or give us any indication of who those experts might be, if there's a timeline for the inquiry, or what the scope will be? The second question I'd like to address to you,